Welcome to the Mint Condition Podcast. Today we're here with Clayton Powers. Thanks for joining, man.
Hey, thanks for having me. I'm excited.
Yeah, I'm excited to have you because Clayton has a specialty, right, in concussions, anything with the brain. Tell us a little bit about that.
Yeah, so I specialize in helping individuals with any kind of complex health conditions like concussion, dizziness, headaches, and then post-illness fatigue. So a lot of
Like
people...
general fatigue just throughout the whole body, or is it specifically brain fog fatigue type stuff?
More like a neuroimmune exhaustion, meaning
okay.
complete exhaustion, fatigue of the whole body. That can happen when people get sick with an illness like COVID or other types of infections and things, or sometimes even concussion. What can happen is that someone will get sick, and typically you think, oh, like a few weeks and I'm better, or even maybe a few days. Some people get sick and they don't actually get all the way back.
So they kind of hit a new baseline that's below where they should be.
Yeah. So
and you're able to help them get back.
Yeah, absolutely.
That's fascinating.
Not all the way. Some people, it is a long process. And sometimes, just like any injury, sometimes their health they're never the same, but we can help them manage this new baseline and try to raise it over time. But sometimes, injuries can be debilitating and
permanent.
Yeah.
So you were saying with COVID, how does that tie into this?
So actually, about the last statistics that were given last year was around 7% of the population of the U.S. developed long COVID. So that means they got COVID and then they developed a chronic health condition from COVID.
So is that 7% of the entire U.S. or 7% of the people who got COVID got chronic?
7% of the people who got COVID.
Oh, okay. Okay, cool.
And so,
got the long COVID, right?
And so they developed chronic health conditions from COVID. And then about 4% of the population, of the U.S. population, went on to develop chronic fatigue syndrome or myalgic encephalomyelitis.
Say that 10 times fast.
I don't know.
I don't think I could say that once.
The abbreviation is ME/CFS.
Okay.
Or some people just go with ME.
Wait, say it again.
Myalgic encephalomyelitis.
Wow. I'm going to have to look that one up.
No worries. And what that is it's a debilitating condition that actually, when you look at the studies on quality of life for chronic illness like multiple sclerosis, Parkinson, heart failure, stroke, cancer, all of those, ME/CFS rates the lowest quality of life.
Wow.
Of all of those.
And that's usually caused by some sort of virus or just any illness out there that just fatigues your neurologic and immune system.
Usually it is an infection like a virus. So about 80% or more are triggered by a viral infection or some type of infection that then kind of changes the way the body operates.
And it never or struggles to fully recover back to normal baseline. So what does that fatigue look like then? Are we talking I just don't want to get out of bed, or I'm trying to remember stuff and I feel like I have brain fog? What are those symptoms?
Yeah, so the number one feature is called post-exertional malaise, which malaise means just kind of, it doesn't really capture the essence of these symptoms. So one of the new terms is post-exertional neuroimmune exhaustion. That's a big term, just meaning people do activities and then the next day or two they go into a crash or where it's not only I can't really do much, but like you mentioned, brain fog, difficulty with memory, thinking, and then just I can't do the things I need to be able to do. And so they'll spend a couple of days or sometimes weeks or months down and in bed and unable to operate. And concussions can, in a subset of people, concussion can trigger that.
Okay. And does it kind of go up and down throughout the year, and there's other factors that play into that?
Yeah, so there can be fluctuations or relapses and things. And so the number one thing that people misunderstand is they think, oh, or they're told by their doctor, oh, you just need to exercise, or you just need to push through. And when somebody is dealing with post-exertional malaise, that's actually the worst advice you can give them.
What is the best advice then?
To pace their activities. So meaning balancing rest and activity. So like with concussion, it's very similar.
Right.
Where you get a concussion, the old advice that was used to be given was, oh, you just need rest. You know, go in a dark room, don't do anything.
Right.
And that
stay
was
awake.
found to be really, that was found to be not so helpful.
Right.
And so they actually changed the concussion recommendations to say for the first 24 to 48 hours, you want to rest and reduce lights, sounds, and interactions or physical activity. And then after that, you start pacing your activities. So
get back.
Do a little bit, but if you have an increase in symptoms, take a rest break, take a break. That can be really hard for Americans. We're really not good about resting. Yeah. We often will push through, and pushing through is like a sign of competence, or I don't know.
Right. If you don't push through, then you're weak. But it actually takes self-control to not push through that. I think that's really common in athletes too.
Oh yeah.
And not just athletes are by nature hardworking, but their coaches and what the team expects of them. And when it's a brain injury, you can't see it. If somebody breaks their arm, you're like, dude, stop for a second, right? But if it's the brain that's broken, you can't see that.
Oh yeah.
And they're like, come on, man, let's go, get back out there. And so it kind of gives that push.
Oh, absolutely. I love that you brought that up, because those invisible illnesses are the most frustrating, I think, for people to go through, because they don't get the sympathy or compassion, because it's like, well, you seem normal, you seem like everything's fine, so why aren't you able to do stuff? And so that's really hard. And then, like you mentioned with athletes, I was treating an NFL player, and like you mentioned, pushing through, it's really hard to convince an athlete to take a step back and to let their body heal and to pace their activities.
Right.
And it's even harder to convince the team that the athlete needs a little bit more time.
Right.
That's really tough with the pressures of having a team calling you saying, hey, when are they going to be back?
Yeah.
When are they going to be playing again?
And those invisible ones, they think they're exaggerating or taking advantage of the opportunity to rest. And that's why they really need to work with people who fully understand the normal expectations of that condition, so that they're getting the proper advice and guidance. And even if I feel fine, I'm ready to go back, well, that's too bad. Like, your body's not ready to go back.
Yeah, that can often be really hard with employers wanting their employees to get back to work and be fully functioning, and then having that pressure of, hey, they're just exaggerating or taking advantage. I've worked with so many patients over the years, and I have to say, I do not see very many people taking advantage. Most people want to work and want to get better.
Yeah.
So I just have a problem with that mindset that there's tons of these patients who are taking advantage of it. I know it happens, but I think it's not.
By and large, it's not. It's not as much. I'm the same way. I've spent my whole career working with people who got hurt at work, and early on, and throughout the last 8 years, people have told me, "Oh, everybody fakes it. If it's a work injury, everybody's faking it." And there's certain doctors I really like working with, and other ones I don't, because they'll call me and be like, "Everybody's faking this. This is a fake," and as opposed to maybe actually assessing the situation. I've had patients who were walked in to my clinic, they jumped from the street onto the sidewalk, and then once they get into the clinic, they start limping. They're faking it, right?
Yeah, when you can observe that change.
But by and large, most aren't.
Mm-hmm.
Most are really injured. They want to get back to work. They don't like the pressure of their coworkers seeing them on light duty. They don't, I don't know. I think people like to work. People psychologically understand how it impacts them when they're not working.
Yeah. I mean, I even had a recent patient who sustained a concussion at work, and the side that the employer doesn't see is like how emotional he became, describing how he almost lost his life at work.
Right.
And that he wants to get back to work because he wants to provide for his family.
Right.
And he has all this pressure on him. And so putting more pressure from the employer or others doesn't help the healing process.
Yeah.
Just support that person, and they're likely to heal faster than if they have all that additional pressure.
Right. Yeah, especially with, like you said, the invisible illnesses, right?
Yeah.
So other than workers' comp, you mentioned NFL, where else are you seeing some of these injuries, whether it's concussion or whatever?
You know, it's funny, when I first got into treating patients with concussions or other types of brain injuries, I thought I was going to see a lot of football players and athletes.
Right.
And I thought especially football. And I would say I think I've seen the least amount from football.
Really?
I actually see a lot more cheerleaders and dance.
Interesting.
Because they're
Right.
going up in the air and falling. And then I've also soccer as well. And
With
then
soccer, what kind of concussions are you seeing? Is it from heading the ball, especially in younger
usually
kids, or is
they'll be
it
sliding or diving for a ball, and then someone will kick them or the ball will hit them in the head.
okay?
And then the other thing we have some random concussions. I see a lot of car accidents as well, contributing to people getting a concussion. But then we have some that are just really out there. Like one time I had a patient who he was on a flight, and a flight attendant dropped something, and he was asleep and just totally elbowed him in the head super hard. And he had to be wheelchaired off the flight and could hardly walk or function for weeks. It was the person sitting next to him said, "Wow, she hit you hard with her elbow."
You.
So he was asleep and that happened. So
random. That's super random. Did that patient come see you then?
Yeah.
Okay. What was the process for them finding you? Did they have to go through a lot of other doctors finally got to you, or you were the first referral?
Usually we've done a good job at our clinic to educate doctors and put in systems where if a doctor sees a patient who has a concussion, this little pop-up comes up that says,
nice.
Research shows that physical therapy can speed up recovery from concussion.
Wow.
Are you going to refer to this physical therapist? And if the doctor decides not to, they have to explain why. And so
that is smart.
I know. So it makes it so that we get concussion patients with concussions referred to us much faster.
Yeah.
And then that means they get the education and advice they need a lot quicker.
That also educates the providers.
Exactly.
Because medical providers can't know everything, right? Mm-hmm. My mom's an NP. She can't know everything about concussion, and she sees somebody comes in with a concussion, go to the ER. But if she put it in the system and it pops up and says, then she's like, oh, I'm doing the right thing by sending them to Clayton. Mm-hmm. That's really cool.
Yeah, it's really great. I mean, we try to get them in within a week or two.
Yeah.
Because even if, let's say there is a natural healing time frame for people, and maybe the person's going to heal naturally anyways, but having that advice, the good advice of what to do, can make a huge difference if they get in quickly and get good advice. So
just ask AI, right?
Yeah, exactly. That's what.
Get on AI. What should I do?
Oh, I don't think that's the future.
Yeah, unfortunately, there's too many variables, right? Mm-hmm. But some of the research I've read on it, because concussions aren't my specialty by any means, but it says on there that delay can double their recovery time. So if they take 3 days versus 5 days to come see you, or 5 days instead of 12 days, mm-hmm. waiting 12 days could mean that it's going to be 8 weeks to get better instead of 4. Is that true?
Absolutely. I see that a lot with people who don't know what to do, or it takes too long to get in. And so they're just pushing through. They don't really know how to manage it. And that's where, like you mentioned, other healthcare or medical providers, they don't have a lot of time with patients. So if you go to the ER or a doctor's appointment for a concussion, they don't have much time to educate or to help you through that healing process. Whereas physical therapists, we have a lot more time with them and can educate and support them with accommodations for school or work. So we're able to provide a little bit more guidance through the
Instead
healing
of
process.
one or two things, you can really dive into it. How much time do you get with patients on average?
I have an hour with each patient. So
every single time?
Mm-hmm.
One-on-one. That's fantastic. In your opinion, because obviously you haven't we don't know the numbers, what would you say the landscape of physical therapy is throughout Salt Lake Valley? Are all PTs one-on-one? Are half of them? What are people seeing?
I would say the majority are likely seeing 2 patients an hour or even more than that. So, and often not one-on-one. A lot of that, at least the outpatient clinics, are often a kind of, you're seeing a couple patients at the same time, or you're working with an aide or a tech or something like that.
Okay. Sorry, that was a total tangent, but I was just curious what your perspective is, because that's what we do is one-on-one. And I think there's a lot of value in really diving into it with patients. But if you're after a total knee replacement, I could see 3 of those in an hour, and all of them are going to get great care.
Yeah.
But if you had a concussion,
something like a concussion or like I was mentioning, chronic fatigue syndrome, or something that is a lot more debilitating or challenging, I think you have to have that time one-on-one to be able to work together, and it's less stressful for the PT. They can really focus on how to help.
Yeah, I remember when I worked in a clinic where I'd see about 3 every hour, and I'd have patients tell me that they felt jealous when I was I was like, that's a weird way to see it, but okay.
Yeah, that's funny. I mean, I hear it all the time. Like, I'll ask, how was your physical therapy appointment? And they're like, well, I didn't really see the therapist very much. I just am working with a bunch of techs or aides. And so, yeah, I enjoy when I get to see them for 5 or 10 minutes. And I think that's unfortunate, because really you want to see the specialist when you're there.
And if it's something more complicated like concussion, or like I do headaches and migraines, then they need that every time. But I can see where some PTs are able to guide the ship and not put as much time when it's a sprained ankle, right? Or a total knee, as long as we're following the right path, and not as much oversight as needed. Other than concussion, post-COVID, are there anything else we're forgetting to mention here that you work with, or that's your whole day?
And balance issues. I also see a lot of people. I love helping people with balance issues or chronic dizziness.
What do you do with patients with chronic dizziness, balance issues?
With chronic dizziness is really a challenging and fun. It's like a puzzle. So people come in and you have to figure out what is driving the dizziness. So is it not getting enough blood flow to the head, so they're not getting enough oxygen to the brain?
Okay.
Is it just a mismatch of their ability to use nerve signals like their vision, their inner ear, and other things to help them balance better? Or so there's a lot of different complications to it, but figuring out figuring out the puzzle and helping them is super fun.
How would you figure out it? For example, like you said, if blood flow is an issue, is that low blood pressure? Is it?
It can be
clots in their carotid artery.
That's funny that you mentioned that, because like sometimes it is something that's totally missed by their other doctors. Like, I have patients who they've been going years feeling chronically dizzy, unable to function, and the main thing I use to figure out what's going on is what the patient's telling me. Just listening and asking the right questions.
That's such a good answer. I love that. Go on.
Oh, sorry. You're good. The number one complaint I hear from patients about going through healthcare is, my doctors don't listen to me. I don't feel heard. I don't feel like they're taking me seriously. Or they quickly just give me some advice like, oh, it's anxiety, you just need to go for a walk or something, and don't actually dive in.
They give the AI answer.
Yes, exactly. That's so true.
I guessed.
Yeah.
You said this, and that. Oh, it's anxiety. Mm-hmm. Like, I had heart issues 3 years ago, and they're like, you have anxiety. I'm like, my heart was beating, and my whole bed would shake and my wife was like, I can't sleep. Stop shaking the bed. I'm like, I'm not shaking it. My heart was just beating that hard. It's like, really? That's anxiety? I don't feel anxious. I'm just laying here.
Yeah.
But it was just felt like a guess sometimes. It's like, can we actually dive into this?
No, and I think that's been a problem with healthcare in general, is that because it's set up where doctors don't have as much time with each patient, they're kind of like scrambling to just give you a quick, okay, it's probably this, or they'll normalize it and say, oh, it's probably not a big deal, so just kind of deal with it. I don't have the time to dig into that.
Yeah.
But that's what I enjoy doing, is actually digging in and figuring out some of these things.
But if they don't have the time, why aren't they referring to someone else who would have the time, especially something where I can't quite figure this out, specialty.
And they'll sometimes do that. I think that's another issue with healthcare that I found, is that often people go, I don't know where to send this person. And then it just kind of gets, the patient gets lost in the healthcare system. I see a lot of patients who have been to 20 different doctors, and then they will find me and we'll work together, and they're like, I have been through so many specialists who all told me, oh, things are normal, and then been able to help them and find solutions. Like one of my patients, you mentioned blockages in the neck or of the blood flow to the head.
Yeah.
I had a patient who, she had a concussion, and then she wasn't getting help. She was going to doctors for her concussion, and they just kept telling her, you got to push through. It's going to get better. You're just it's anxiety, it's depression. You just need to push through.
Right.
And I saw her about a year after the event, and she had already been through all that, trying to get better, pushing with PT to help her. And when I saw her, I started asking questions that led to her saying, no, I feel like nobody's listening. I feel like it's in my neck. And I said, okay, let's check your neck. And
were you the first one to stop and look at her neck?
Others had looked at her neck, but they just kind of saw it as like, oh, neck pain.
Yeah.
But she's like, I think something's driving my symptoms, all my symptoms up here. So what happened, and this is really interesting, because I lifted gently on her head, and she goes, I feel like I can breathe now. Wow. And then as she stood up, her heart rate would elevate like 35 beats higher when she was upright. I gently lifted up on her head, and her heart rate came down 30 beats. And she's like, I feel normal. So then I got her specialty testing and imaging, which I have to say, her medical provider called me and was like, I don't know what you told her, but she thinks that something's going on now since she saw you. And I just think she's depressed, and I don't want to see her anymore. And I was shocked. She goes, she just needs to get over it and get back to work, and she's just depressed. Well, we got her in with a specialist. They found that she had, since the whiplash injury, she had her vein and artery were bleeding into each other. So they did surgery on that. Then they found that her blood vessels draining her head, her internal jugular veins, were not draining. So they had to do a stent to keep that open. And then now she's starting to improve and do better. But there's just kind of wrote her off saying, oh, it's just depression. Yeah. And she had been saying, no, I feel like something's being missed.
Yeah. See, it is hard, because there are people who make up symptoms or embellish or whatever. But you've got to really listen. You got to hear what they're saying.
Yeah.
And get rid of your ego. Refer out. When somebody, do what you can, right? Like if somebody comes to me with a concussion, I'm going to do what I can. And because there are some simple ones or smaller things that I understand enough. And then when it's not good enough, send to another PT who specializes in this. There's too many who either don't spend the time to learn about what's out there, right? Yeah. Like I love dry needling, okay? When I first graduated, acupuncture was available and still is. Yeah. Dry needling was more scarce. Why was I not referring to acupuncture? I didn't understand the options that were out there, which means I did a disservice to my patient. So that's actually one of the points of our podcast. We're hoping this information, the PTs out there, chiropractors, whoever out there, are meeting you and recognizing what you do so that they can send the patient to you.
Yeah, we all help each other by finding where that patient is going to fit best and get the most help.
Yeah.
And there's so many patients. There's no, I guess I don't feel competitive or anything about it. It's like there's so many people who need help.
Yep.
So get them the right answers and help.
And what I've found as we've done that is more people, whether it's other providers wanting work with us or more maybe karma, I don't know. But I send patients away all the time. When it's the right fit for them, get them somewhere else. I want to tell you a story about this, but there's a certain person on the radio. I won't embarrass them by sharing their name here, but they shared their story about their injury on the radio a ton, and I happened to be listening. They'd been to 4 doctors before I heard this on the radio. So I texted the station and said, I know what's wrong. I can help, because all 4 doctors couldn't figure it out. They were ordering MRIs and all this stuff. And it was really cool, because the radio host texted me back 6 minutes after and said, I will call you when I'm off the show, and called me. I went to his house, worked with him, fixed the problem. And blown away that he'd been to the ER. He'd been to 3 other doctors. No idea. But that's where those doctors need to know what the options are out there. And patients, the community needs to know that we have a specialty. We're not just personal trainers, right?
Yeah, absolutely. I mean, I was just thinking, I don't think sometimes people recognize the value of PT.
Yeah.
The time we have with people, and then the problem solving capabilities, like just sitting with a patient and figuring out how we can navigate what's going on with their body.
Yeah.
And so a lot of times, like going through ER visits or other healthcare provider visits, their options are kind of limited. A lot of times other healthcare providers, their options are, what medication do I give you? Do I need to do some labs or imaging?
Yep.
And then physical therapists, we have a different frame of reference that we use.
Yeah.
It's more problem solving. How can I help this person function better, or help them with their mobility or strength or whatever it is? We have a lot more tools than just exercise specialists.
Right. Yeah, and the people think, and I don't know. That's hard for me when they think, oh, all you do is exercise. Like, well, they're not ready for deadlifting, so they can't come see you yet.
Yeah.
It's like, I can diagnose, I can like break down what's going on and figure this out just like any other doctors, and in some conditions better.
Yeah.
Right? If you have a cold or a kidney infection, I'm not going to be the one to figure it out.
Yeah, absolutely.
I found a patient while I was working in the hospital who had cancer in her shoulder. But that's as far as my knowledge goes. I knew to refer to an oncologist, and that's it. But I was able to recognize those flags that told me that was going on.
Yeah, and PTs, we are trained and specialized to know when something's abnormal and it needs to be referred out to a different provider.
Yep.
But also, we have an expansive skill set that's more than just treating pain. We can also treat dizziness, fatigue, headache, balance issues, a lot of these other challenges that people face, and pelvic floor, for example, bowel and bladder issues.
Yeah.
I've been blown away, because as I've worked with so many different PTs, it's amazing the expansive set of skills that our profession has.
Oh yeah, and it's incredible. But that's where it's beneficial to know the specialists. Send them to a PT who does pelvic floor, not to you or me, right?
No. Please don't.
Yeah, don't send them to I'm the same way. What got you into brains then? Because PT is normally, you tore your ACL or rotator cuff. Why brains?
Yeah, I initially was, when I first graduated, I was primarily doing musculoskeletal issues like back pain. I was treating shoulder pain, things like that.
Where were you when you first graduated?
I started at the University of Utah and have been there since.
Wow, they can't get rid of you, can they?
And so since then, I focused on that initially, and then I started wanting to get into dizziness and balance issues, and so I took some extra courses and started treating a lot of patients with BPPV or vertigo and dizziness, and then concussions as well. They're kind of in the same realm.
Yeah.
And then that just led to the more I saw patients with concussion, I would find people who had blood flow issues to the brain that were impacting their symptoms. So I tried to learn as much as I could about that.
Yeah.
And that led to the chronic fatigue therapy. And then COVID hit. And so,
wow,
yeah,
perfect timing. Steps pushing you that direction.
Yeah. And one of the things I've always, about 5 years ago, I made the decision, if I can treat the hardest patients, the hardest cases, then everything else will be simple. So I just started taking on some of the most challenging patients. And it's true. Now, if I see somebody with knee pain or something, it's so much easier. Yeah. It's like, oh, I don't have to use as much brain power. But I've started enjoying the puzzle and trying to really help people who are really struggling with debilitating issues. And I would say maybe once or twice a week, I have patients who become emotional in the clinic and say, I've been struggling with this for years. No one's been able to help me. Thank you so much.
Right.
And that's super enjoyable to make a difference.
So rewarding, right? Like if they have back pain and you help relieve it, they're like, okay, well, that was cool. And sometimes it can be rewarding when it's more complex, but when it's something that they've been to multiple providers, it's been a couple years, man, that's so fun. I love that.
That's the joy in being a physical therapist, when somebody really needs help and they're just not getting the help they need, and then you're able to provide something that really changes their life.
Right.
That's what makes all the difference.
Yeah. So talking about physical therapy, what's a myth or an idea about physical therapy that you wish people understood better?
Yeah, kind of as we talked about, the physical therapists are just exercise specialists. Okay. Or the worst is when I had somebody show up and we went through the whole appointment, and then at the end he goes, so now are you going to give me my massage? And I was like, oh, sorry. I guess we were on the same page as far as expectations, that he was expecting PT. We were just going to massage him. So just that sometimes it's too simplified. It's like, we are doctors of physical therapists and of physical therapy, and we can provide a lot more education and guidance and explain things more than just exercise or just hands-on treatment.
Right. Yeah, it can be so many more levels to that. And hands-on treatment and exercise are super valuable in the right situation, but it comes after the value of an assessment, of really knowing what we're approaching. I've worked with several therapists who have worked in clinics where they just had the knee program and the back program, and you might as well watch a YouTube video, right?
Exactly.
It's the same thing as as watching a YouTube video, because it's just a set program, nothing unique about you, nothing to fully assess where is that pain coming from. Is it from the hip? Is it from the ankle? Or is it directly from the knee itself? So, yeah, I wish people understood that more. I don't know how to get the message out better other than doing a podcast.
Yeah, that makes sense.
So,
and like you mentioned, I think when people, I used to have this fear that we might get that we might be replaced by YouTube videos or people just showing a bunch of exercises. Like, you can find that stuff, but I think where we shine is the relationship building and guidance. Yeah. So patients, they want that relationship, somebody who is trying to help them reach their goals, or that coaching. Right. And you can throw exercises at problems, and sometimes it works really well, but a lot of times where we shine is building that relationship and helping people toward that goal, being an accountability partner. Yeah. I
mean, the life coaches out there is a really popular thing, right? Well, we're a life coach for your injury. We're injury coaches.
Mm-hmm.
And what's really cool about what we get to do as there's more resources out there, because there is some great stuff on YouTube. There's Google and AI, like look stuff up, and you're living more fit. Any PT who's complaining doesn't have an abundance mindset. Why are you complaining? That's great. They didn't need you. Then you, with your skills, your brain can focus on that higher level, which I love you were saying. You focused on the hardest things so that the other ones are easy. Well, some of those easier ones you don't have to waste is the wrong word. Spend your time treating because the YouTube video can do it.
Exactly.
Right? And so all those resources I'm a big fan of, as long as the asterisks, right? As long as it doesn't make somebody get hurt, because there is that risk. Like what YouTube said, I have knee pain, I should do XYZ. And it made it worse because you actually had a torn ACL. And knees over toes guy, love his stuff, but that's going to make an ACL tear worse if you're doing the squats that he does. Have you seen that?
Yeah, it's all context, knowing, okay, yeah, that exercise in that video is good in this situation, but your situation is different.
Right. Yeah, exactly. Well, what other things about physical therapy that you talked about, all the brain stuff that you do? Do you treat any other conditions?
I still see people occasionally for shoulder pain, neck pain, back pain, stuff like that, or whiplash injury from a car accident or things.
Okay.
So I still see those things. It's just in a different mindset about how to approach it. It's more approaching the whole person and seeing everything going on versus just like, oh, you hurt there. Trying to get a bigger picture of how I can help them in all the areas of their life.
So if a physical therapist is listening to this podcast, right, and they have patients they're struggling with, because not all of us are as trained as you are, right, to look at the whole big picture. We try, and PTs over the years, hopefully they keep getting education so they can do more of this. But if they're struggling, even with shoulder pain, they could refer that patient to you.
Yeah, absolutely.
They're just not getting them better.
Happy to help. I like seeing patients where it's tough and it's hard, and we have to figure it out. Yeah.
That puzzle part really is the most fun about all of it, especially if the patient's bought in, because it's like, it's hard with patients that I want to break it down. Like, let's really work into this. And I want to get back to work, and like, okay, but I want to fix this. So it's really fun. They're bought in, and you get to spend time, dive into it, and really help people recover.
Yeah. And I use a lot of things that are maybe like I didn't learn most of the things I utilize in school for actually instructing the patient. For example, like a lot of the stuff related to lack of blood flow to the head when somebody's upright doing things. A lot of that I learned after school, and just working with lots of individuals and reaching out to specialists around the country who treat individuals with complex issues. That has surprised me. I would see somebody on YouTube talking about physical therapy for something, and I just contact them and say, hey, can I talk to you and chat? And I want to learn from you.
That's awesome.
And just trying to learn from everybody. Yeah. Like I've visited chiropractic clinics and just said, I want to learn what you do. I want to learn from you. And I think that, I don't know, that we get into silos of, oh, this is my specialty, or this is my our profession. Right. And I'm like, I want to learn from dietitians. I want to learn from mental health providers. Right. I want to learn from all of them.
But that brings it back to the idea of knowing what's out there and available, because you want to learn from all of them, and then you're able to help on the nutrition level, on what all those different levels to some degree. Mm-hmm. And then when you're like, okay, I didn't quite learn enough, because you can't know everything, you know who to refer them to. Okay,
that network.
Nutritionist, chiropractor, and really help these patients. Like you were saying, that scarcity mindset, there's so many people to help. And if every provider is doing that little bit more to get smarter, to be aware of acupuncture and nutrition and bio something, the list goes on and on. But the more that we know about this, then we can help people to some degree and refer better, and don't have a minimalist mindset.
Oh yeah, absolutely. I feel like there's so many people out there who need help, And there's so many things that we still have to learn. We don't have all the answers. So there's a ton of people of different professions and within our own profession who have great things to teach us. And I have learned the most from my patients. They're the ones who have taught me the most how to help. Wow. Not my schooling.
Yeah. Yeah, that's cool.
I mean, the schooling sets a frame or a foundation, but really you learn from the patient's feedback.
That's so smart. Learn from my patients. I don't think I've ever heard a medical provider say that before. I learned the most, especially someone who's as qualified as you are, say, I learned the most from my patients. That's huge. I had to repeat it just so
you're good.
Get that message out there. Like, people need to listen to their patients and learn from them.
Yeah, they'll give you the feedback and tell you what's going on. And there was some research actually looking at that from Mayo Clinic, I believe, and it said that patients were interrupted by their medical provider every 11 seconds when they're trying to explain what's going on.
Yeah.
And it also looked at how long it takes for a patient to actually share their core problem or issue that they want addressed, but that by interrupting them so much that actually took longer and they didn't actually feel like they were heard or got what they needed across.
Right.
So I was shocked by that they're interrupted by their medical providers so frequently.
Yeah, every 11 seconds. I've heard about that before. It blows my mind. And I wonder if it's because have they taken that study and broken it down by medical versus PT versus chiro versus...
I'm not sure. That'd be great to look
into. They should, just because if I was a medical doctor and I got 10 to 15 minutes, I'm going to interrupt them because I got to get to my next patient. How do I give you the bare minimum to get you shut up, go away because I got my next patient? Hopefully they're not saying that. I'm not trying to put that on them, but that's how I feel like I might be.
Yeah, I know it's not the doctor's fault, it's the system's fault.
Exactly.
Where they're in a system where they have to say, give me one thing, one symptom.
Right.
And it's almost, I have told patients this, I've said it's kind of like a vending machine where it's like, give me your one symptom and I'll give you the pill you need for that. Yeah. And that's how it's kind of set up. It's like dizziness. Okay. Do we have a pill for that? Oh, yep.
Here's the pill.
Here's a pill.
See, that makes me think of the TV show Scrubs. Oh, yeah. Because they talk about, here's their two symptoms. And they're like, oh, do this. They're like, but they also have this. Oh, don't do that. Do this. That's a big deal. Yeah. You've got to hear more of the symptoms, but that sure is how it seems like. We need to get the whole story and actually hear the patient and not interrupt them.
And I think physical therapists or other healthcare providers who have more time can get that full story and then share the story with the doctor to say, hey, here's what I learned from them. Often I will message doctors and say, here's all the things I learned from that patient. And here's what's concerning. And they go, thank you. Like, that's super helpful because
is your feedback
more information.
Is the feedback always positive from all these doctors, or what do you generally see?
Half the time, usually there's a thank you that's helpful. Right. Who do you want me to refer them to? Right. Basically, the more complex it gets, the more I don't have the time for that, or I don't have the specialty. Right. So what do you want me to do? I'm not capable to take on this. So where should I send them? And that's the hard part, is everybody usually wants to defer if it starts to get complicated.
And that's the system again, right? Yeah. But that's not a terrible thing, right? Who do I refer to? Mm-hmm. Like, let's get this to somebody else's plate. I don't have time. I want the patient to get better. Let's get them out there. That's what PTs need to learn, though. This is where I think PTs have struggled. We don't refer out. Mm-hmm. Right? Because we're the bottom of the rung. You already got pain management, surgery, now you go to PT. Yeah. So we need to learn how, because we can order MRIs and X-rays. Just last week I talked to a PT, had no idea that they could order MRIs and X-rays. Right. That's been since 2018. And we were trained in school to recognize when that's needed and even read the reports. So we need to be referring more. We need to order the imaging at the appropriate time and not just say, well, if it was needed, the doctor would have. Yeah. Right? The doctor didn't get to see him twice a week for an hour each time. They got 15 minutes. once. And so we need to be an advocate for the patients.
Yeah, we get a much bigger picture of what's going on. We get to know their family. That's what I love about this is like you can really get to know people, that relationship, but then that also means more responsibility of managing. And I think we can fill that gap that's in healthcare right now. There's a shortage of doctors and healthcare providers for the number of people out there, especially in Utah.
What's the wait time to get in and see an orthopedic doctor or a neurologist?
It can be a while, like it can be a month or so. Sometimes
depending on the specialty, right? Yeah. Some of the neurologists, I have some patients I've been referring out to the neurologist up at the U, or I think it was over at Tosh. I don't remember. The U was the most recent one, and it was a 9-month wait to get into that neurologist. That's crazy.
Yeah.
And so we need to be more available, which is why PTs are now primary care providers. What does that mean to you, your practice?
Yeah, I love that we have this new legislation that came out that PTs are primary care providers, because we already had direct access. So if you're a patient, you can go directly to a physical therapist and be treated without a doctor's referral.
Yeah.
Depending sometimes on insurance. But
right.
But overall, I think it allows us to fill in some of those gaps in the healthcare system. And like, for example, there are PTs who work in the ER. And I think that's an amazing opportunity as well, because a lot of people go to the ER or urgent care for back pain or a flare-up of
headaches and migraines.
Or headache or migraine. Yeah. And having a PT in the ER or to fill this gap and provide care wherever, whether it's an outpatient clinic or in the ER or wherever, I think PTs can become or be the primary care providers. One of my colleagues, he works in the ER, and he said, sometimes the doctors don't even use me for a specific, like let's say kidney infection, since you mentioned it. He said the doctors will sometimes say, can you go in and just talk to the patient, because you do a really good job of just reassuring them and being there. So
just not good even bedside manner.
Yeah. So he wasn't even, it wasn't about the actual illness. It was more, can you be that primary care provider who's just there to reassure them and give them guidance?
Wow. So I love that.
Yeah.
So has that changed your practice at all?
As far as being a primary care provider, I feel like I was already kind of utilizing that and navigating. I was referring people out to specialists and trying. So I felt like it was more confirming what I'm already trying to do.
Just more legislation that supported that, and hopefully will change Medicare laws and insurance laws. No insurance should be able to stop a patient from seeing you and wait for a doctor to say, yes, that's okay.
Yeah.
Like, nothing against the MDs, but why put that barrier in the way?
Now, wait time and we want to remove as many barriers for people getting help as we can. And as you mentioned, like some of the wait times, I find it crazy. Like there's a geneticist, for example, and a lot of patients will say, I got on his wait list for 2 years from now. He'll have an appointment for me, or a neurologist, and it's over a year.
Yeah.
And I say, okay, so you finally got in. How was it?
Yeah.
Was it worth the wait?
Yeah.
And they're like, no. They basically told me what I already knew and what you've already been helping me to manage.
Yeah.
And it's like, man, that's not value.
And they needed that education earlier on.
Yeah.
And hopefully more education, but validation. Mm-hmm. Sometimes, especially these complex cases, as smart as you are, I'm assuming it's still helpful to have some validation, whether it's through imaging or sometimes a second opinion. And
absolutely, and just to make sure that you're on the right track with because you're going off of what you're seeing and what the patient's telling you, but to have some level of that is what you are dealing with can be helpful. You mentioned validation, so I have to say this.
Okay.
I think that is one of the, like I was talking about reassurance, the PT providing reassurance in the ER.
Yeah.
I feel like validation and listening are some of the best therapeutic tools we have, or treatments.
Yeah.
I consider them treatments.
Yeah.
So oftentimes patients will come in and just validating their experience and reducing their stress, helping them feel like they have someone who's going to be supporting them and helping them, can drastically reduce their symptoms.
Yeah.
And is therapeutic.
Yeah. Oh, 100%. They need that from us. One of my favorite things early on when I was brand new PT, I didn't even feel near as confident as I do now in what I'm doing, but I did know what pain was okay.
Mm-hmm.
I worked in a clinic that did a lot of post-surgical stuff. So rotator cuff tear, 6 weeks out. This is okay. This is normal. And they're like, but it aches all the time. Yep. Oh, okay. Like, that's normal. And that makes such a difference for patients. I want to ask you what mint condition means. But first, what advice would you give to other PTs out there who are already graduated, trying to become better at this, communicating with patients, whatever, or to PTs who are in school right now?
I would say one of the top things is to, like I said, listening to your patient. They will teach you the most if you really are listening to what their goals are, what they want to achieve. Oftentimes, I think we get in this rut of, this is how I learned to be a PT.
Right.
These questions, these things.
Well, you had to pass it off in school.
Yeah,
right?
You have to pass it off. And so people can get stuck in this routine or traditional approach, and being willing to try some new things and to learn new things. Even, for example, I didn't learn a lot of the things that I am now doing. I didn't learn in school necessarily,
Right.
but it was working with the patient and self-taught and talking with experts, networking. All those things are what really make the difference in somebody getting better. Even, I think, for example, the technologies that are being quickly developed with AI, wearable devices and all these, it can be intimidating to implement all these different things, but it's just trial and error, a lot of practice. There's new devices that are going to really change how we operate as PTs and help people with their health. So, for example, the Lumia device, it's a device that goes in the ear and helps track blood flow to the head, so that we can measure and give people good advice. There's devices for monitoring temperature changes in people, sleep or stress. I think that's a huge area where we as PTs can stand out, is utilizing technology and health monitoring to be coaches or guide people in optimizing their health too.
I think PTs need to branch out more into that.
Yeah.
Like I've seen it more and more. Have you used Shockwave at all?
Mm-mm.
So Shockwave is just an example of a device that PTs are like, well, chiropractors do that. Well, why do they do that? Maybe it's helpful.
Oh, Shockwave.
Why aren't we? The treatment tool, right? We need to, sometimes we get stuck in, well, if I'm not doing it with my hands or it's not an exercise, then what am I? I'm just pawning it off. No, you're making that recommendation. Get this device, Lumia, that goes in your ear. Is that how you say it? Lumia? Yeah. Or try Shockwave or try this. And we need to be aware of that to be a clinician and a provider. So I think that's super valuable advice for therapists out there to branch out and not just get stuck in the rut. You have to start there because you got to learn from somewhere, but branch out.
Expand your toolbox.
Yeah.
That's what I've tried to do, is as many tools as I can pick up from as many people. Like, I want an expansive toolbox that I can reach for these patients who are really struggling and figure out options for them.
Yeah.
So like you said, I've gone to chiropractic clinics and said, what do you use and why? And like tried to learn from them and other professionals, because we get stuck in this, like, this is how PT should look, versus learning from all the other professionals. And they may do something. It bothers me when PT students are like, well, this is, that's not evidence-based, or that's not this. And it's like, don't just throw everything out until you at least learn about it more.
So you do dry needling, right?
Yeah.
My brother went to a physical therapist down in Lehigh, and he asked her about dry needling because I've done it with him a bunch. She's like, "Oh, that doesn't work." He's like, "So are you trained on it?" She's like, "No, I'm not taking a class on it. It doesn't work." Maybe you shouldn't share an opinion like that you don't fully understand.
Yeah.
Right?
Be curious.
Yeah,
Go
be
learn
curious.
more.
And study it. Like Shockwave, when I first heard about it, I was like, it's just somebody creating a device that will just to make money off of people.
Yeah.
But then you learn, why not actually read the research before sharing an opinion, especially when you're a physical therapist treating a patient in a position of authority. You just told him straight out, that doesn't work.
Yeah, instead of, I don't know a lot about it, but I'm eager to learn more, and and I can research it and get back to you on that.
Yeah.
Instead of just shutting down anything that seems out of the ordinary.
Yeah. Or you heard one thing that said it was negative.
Yeah.
Right. All right. Last part. We ask everybody this. What does mint condition mean to you?
To me, mint condition is less about your physical state. It's more about your wholeness in general, how complete you are. So, for example, I have some incredibly resilient patients who have debilitating illnesses and injuries who are still have strong, positive social relationships. They have a strong mindset, and they're pushing to stay positive through their injury or illness. And I think that's more important than what your physical body or your circumstances are. That mindset and that like gratitude for life and just and being able to stay positive.
I like that. That's a really good answer and unique. You talked about reaching out. How do people reach out to you? Can other physical therapists contact you and learn from you?
Yeah, absolutely. I'm always eager to have good conversations like this. So one option is just emailing me directly at Clayton at powers-wellness.com, or you can text me or call me at 801-999-8095.
Perfect.
Happy to talk to anybody.
Yeah, have a conversation. People can lean on you to chiropractors, physical therapists, MDs, get that experience from you and keep that network growing.
Absolutely. And I have tons of resources and other things that we're producing to try to help patients with complex conditions. So, for example, like we have some YouTube videos for patients and healthcare providers who with chronic fatigue syndrome or long COVID.
Nice.
They're on the Bateman Horn Center YouTube channel.
How did they find that? Is it just
Bateman Horn
search
Center?
Okay. Perfect. We'll throw up that information also in the descriptions of our podcast so people can find that resource and hopefully share it to
Awesome.
more people.
Thank you.
Thanks for coming on.
Yeah, thanks.